Hello, my name is Liwen Chen. I'm Assistant Professor of Pediatrics in College of Medicine, National Cheng Kung University, Taiwan. I'm going to introduce our study about early neurodevelopmental trajectories for risk of autism spectrum disorder in children born very preterm. Developmental markers for early detection of autism are emphasized for the benefits of early interventions. However, there's still a lack of appropriate markers for autism spectrum disorder at toddler age in the very preterm population. It is reported that the neurodevelopmental trajectory is related to the risk of autism, but it has not been validated in children born preterm. In this study, we hypothesized that in the very preterm population, mental performance trajectory patterns could be an early developmental marker for autism spectrum disorder. Let's see how we test our hypothesis. We enrolled children born very preterm from 2008 to 2014. These children were prospectively and longitudinally evaluated with Bayley scales of infant development at 6, 12, and 24 months of age. At 5 years of age, ADIR and adults were administered. Finally, we ended up with 29 children with autism spectrum disorder and 290 children without autism for analysis. By using group-based trajectory modeling, the mental scores by Bayley scales of infant development across 6, 12, and 24 months of age could be classified into 3 trajectory patterns. 31% of children showed a consistent well mental performance and belong to the high stable group. The majority of children follow the high declining trajectory, which showed a stable mental score before 12 months, but a declining trend during 12 to 24 months of age. A small proportion of children, about 7%, were classified as the low declining trajectory. They started from a lower mental score at 6 months of age and kept declining during the second year of life. Children in the low declining trajectory had the prevalence of autism spectrum disorder as high as 35%. In contrast, the high stable trajectory had only 3% of autism prevalence. Children in the low declining group had 15 times higher odds of autism spectrum disorder than children in the high stable group. We also found that male infants receiving longer duration of oxygen therapy and with lower maternal educational level tended to follow the low declining trajectory. Further multi-center study collecting detailed family history and the parent-child interaction pattern is required to validate our findings. In summary, the mental trajectory pattern before 2 years of age could be a developmental marker for autism spectrum disorder that could lead to early identification and intervention of vulnerable children born very preterm. Clinicians and parents may look beyond the developmental quotient that the behavioral aspects should be emphasized in children who show a low or declining mental trajectory.